Welcome to Voices in the Wilderness, conversations about church and leader health. Thank you so much for listening. We encourage you to keep the conversation going. Voices in the Wilderness is brought to you by Preparing for Amazement Ministries, where we empower and equip churches and leaders to create lasting and transformational health. Visit amazed15.org to learn more. We also welcome any comments or suggestions. Simply email us at podcast@amazed15.org. My name is Marcus Carlson, and today our guest is Connor Boyer. Welcome, Connor.
Hey, thanks for having me back.
Yeah, awesome. So this is kind of episode two. We're doing kind of a two-part series on the impact of church health, and uh, Connor serves at a church I've been working with, not just in the context of our ministry, but as an intentional interim pastor, and been doing that for a good bit, a longer season, and so I thought that would be a good source of information for our listeners to think about.
Yeah, thank you.
So tell me, kind of, what are some specific cases, without, betraying confidentiality or too many details, right? Where you have seen the health of the church that you're serving change is they focus on the church health and lean into the habits of healthy churches.
Yeah, I think the biggest area that I've seen a huge shift, a huge change at our specific church has been the relationship between ministry leadership and then executive leadership. Growing up, getting really coming up in a ministry context that I was in, that relationship was really fractured. And as we've gotten healthier, there's been intention to building that relationship, spending time together, doing things like retreats, really collaborating on a lot of things. And, I really think that, that's been a huge shift. And uh, it's been, I think, the best thing for our church in terms of getting healthier.
Awesome, awesome. Yeah, and I think that it's easy, for leadership to not be on the same page, and not always intentional, and certainly not always, divisive, but disconnection is a real thing sometimes.
Yeah, and I think that was the heart of the problem is like, we were really kept separate, and I think there was natural feelings of trying to work against, each other, and I don't even think that was intentional on any of our parts. It was just kind of the way things were laid out and what we were working with. And as we've gotten healthier, I think there's been a lot more intention and purpose, not just communicating more, but connecting more and being on the same page and all working towards the same goal. And I think that's the biggest sign of church health.
Awesome. Yeah. And I hope, that's been encouraging for you and for our listeners, to be encouraged that, there is hope and these things can certainly get smoother and easier.
Well, yeah, and like it's the heart of the gospel is redemption, right? And relationship, and that's what and the ministry staff. That's what we're always preaching. But when you're working in a church, you kind of don't realize how much you need that in your professional kind of environment as well. And so it's been a really blessing to really see God working through that over the last couple of years.
Awesome. Awesome. Well, one of the most problematic things in the health of a church is conflict. How has focusing on healthy habits and healthy conflict impacted the congregation and its ministry from your perspective?
Yeah, I think we do conflict well, and I think something that I've noticed too is conflict isn't like the big, scary monster that we're all trying to avoid. And two, like even in like things like congregational meetings, there's not as much conflict going on, and really, I think our congregation again, kind of, I think I mentioned last episode that attitude reflects leadership. I think the attitude of the leaders at our church, being committed to being healthy, and one of those habits is doing conflict well, has reflected off onto the congregation. I think that's been really cool to see, and I don't think conflict isn't bad, but unhealthy conflict is. So it's doing it in a healthy way.
Yeah, for sure. And certainly there'd been plenty of that historically, in your context. And hopefully there's less. There's always going to be some, but again, more importantly, it's not the quantity, but the quality of it.
Right, exactly.
What advice would you give churches and leaders as it relates to focusing on the health of the church?
I think, a couple, I guess, tidbits of advice I would give is one, really be, just go all in and really give it a chance. I think it's easy to be skeptical, like I was when we first started, but the fruit speaks for itself, and so just be committed. And the two things I would say is, the focuses that were most important for me personally that I think have affected kind of the specific ministry that I do is the two habits that I've worked the most on is valuing process and praying. And so those would be two that I think would be important to be high on the priority list.
Yeah, and I appreciate you kind of mentioning skepticism because I think it's natural to be skeptical. Certainly a church that was in transition, but skeptical about some of this stuff. What would you say to folks that, maybe are skeptical about the habits or skeptical about, health? What kind of encouragement would you offer them?
I think God works in ways we don't expect, and so I think just being open to that you don't have the answers, and that uh, you know um, I just think really just being open to the process, and really these 7 habits are not just things for your church; they're for you personally, and so I think challenge yourself to really be open to them. And I think, you'll see God move in ways you didn't expect. And that's really been my experience with this whole healthy and process.
Yeah, and I think too, as you talked about earlier, kind of it infecting the congregation. One of the things that we tell churches is, if you can get all your leaders to do this, especially habit two conflict, if you can get everyone to do this, eventually it will infect the congregation. And, there'll always be some. But, I think what happens is that those folks that don't want to get on board with healthy conflict, they either quiet down or they transition out or nobody takes them seriously. And I think one of the cool things about this environment has been, because I don't always get to see this, we don't always get to see this, depending on how long we're working with the church, but watching the congregation members correct each other when it comes to conflict, not just me correcting people or staff correcting people or leaders correcting each other, but really nobody likes to be held accountable. But it's
Mhm.
interesting to watch kind of congregation members say, hey, that's not how we do things here.
Yeah, and maybe you can speak more to this. This could just be a specific to our context, and maybe we're an outlier. But one thing I've noticed is that I think it was easier for the congregation, or maybe I should say we had an easier time with the congregation kind of adopting this, more so than the leadership. Like the once the leaders were on board, it was easier to pass it on the congregation. You know what I mean? I think the harder, or not the harder, but the longer transition was all of us leaders kind of getting, this right. And then once that was, taken care of, or once we were all on the same page, that the congregation just really took to it after that. So
Why do you think it was harder for leaders to?
I think with our context, I think there was a lot of confusion. I think at our church about what roles we were supposed to have. Elders, board, staff, all of us. I think there was a lot of just manipulated confusion, and so I think that was probably a big part of it.
Yeah, and I agree. And I think certainly again, going back to that muscle memory and change is hard and scary. And so I think that, and probably for the leaders, this is something that they're thinking about daily or weekly, where the congregation members is if they're thinking about it at all, it's not very often. And
Hmm.
so that, certainly may be a piece of it. It's kind of when you're in those leadership roles or on staff, it be kind of comes all consuming where the average congregation member is just trying to get through their day between work and home and family and everything else.
Right. Yeah.
Yeah. Well, awesome. I appreciate kind of your input and again taking time for us to record a couple short episodes. And yeah, I think having our folks here about specific churches where this has had an impact is really helpful.
Well, I appreciate it. Thanks for having me, and thank you for all you're doing too for our church. It's been, awesome to be part of, even as someone who was skeptic in the beginning. You
Yeah,
know
just
more
a
about
little,
that
right?
than I do.
Is that it's a confession on a podcast? No, I
Yeah.
appreciate that, and yeah, it's been good. It's great when it works, and
Mhm.
so I think the slugging through becomes worth it when you see the other side, and you go from kind of toxicity and difficulty and anxiety to kind of playfulness and joy and health. It's fun to watch.
Yeah. It's been a ride.
Yes, that's for sure. That's for sure. Well, again, if it were easy, everybody would be doing it, and so that's just not the case.
Yep.
Awesome. Well, thanks again, Connor.
Thank you.
Thank you so much for listening. Voices in the Wilderness is brought to you by Preparing for Amazement Ministries, where we empower and equip churches and leaders to create lasting and transformational health. Visit amazed15.org to learn more. We welcome any comments or suggestions. Simply email us at podcast@amazed15.org.